As COVID-19 case numbers continue to rise, the province of Manitoba held a news conference today to announce new health orders with additional restrictions. They continue to endeavor to give fully vaccinated Manitobans as much freedom as possible while curbing the spread of the virus. Once again, Manitoba is later than other provinces coming into this wave of the virus, but we are now firmly in the fourth wave. Dr. Brent Rusin shares some modeling slides that show the current trajectory of increasing numbers of cases, hospital visits, and ICU admissions without further restrictions, particularly in the Southern Health region. In Manitoba today, there are 193 new cases, 23 of them in Prairie Mountain Health. Regarding the outbreak at Neepawa Health Centre, there are currently a total of 20 active cases being reported, 8 staff and 12 non-staff. We now join the press conference with Health and Seniors Care Minister Audrey Gordon, Dr. Brent Rusin, Chief Provincial Public Health Officer, and Monica Warren, Provincial COVID Operations Chief.
Good afternoon. Thank you for joining us here today, and thank you as well to Dr. Rusin, Chief Provincial Public Health Officer, and on the screen is Monica Warren, Provincial COVID Operations Chief with Shared Health. So thank you both for being here. Today, we're here to discuss an update to public health orders. Rising case counts and COVID-19 transmission in the province means we need to introduce new measures now to reduce the impact of COVID-19 in our province. Case counts and hospitalizations are rising, and we must be proactive in protecting our healthcare system and ensure we have hospital beds available to continue to provide care for patients in need. Once again, we must ask Manitobans to do more to reduce the current COVID-19 case numbers and community transmission, which in turn will help reduce the strain on the healthcare system. To increase preparedness and address the fourth wave, the province has taken 3 key steps to help reduce COVID-19 transmission. These new public health orders will still allow fully vaccinated Manitobans to continue to enjoy as much freedom and as few restrictions as possible. We are not helpless in the fight. We need everyone to work together by following the public health orders, focusing on the fundamentals that we've talked about so many times, and getting vaccinated. We know vaccination works, and I encourage all Manitobans to do your part and get immunized against COVID-19. Thank you to the hundreds of thousands of Manitobans who have participated in our historic vaccination efforts thus far. You did your part by rolling up your sleeves not once but twice to protect yourself and your fellow Manitobans. To date, over 87% of Manitobans have received at least 1 dose, and over 84% of Manitobans are fully vaccinated. I'll now pass it over to Dr. Rusin to expand on the new public health orders. Dr. Rusin.
Thank you, Minister. So I'm Brent Rusin, Manitoba's Chief Provincial Public Health Officer. Before I go into the updated restrictions being announced today, I want to walk through a few slides on modeling and just take us through that. So we'll get started on that. So our current state, we can see that numbers over the past 4 weeks have been climbing. We see that the predominant climb during much of that was in the Southern Health region, which we had previously been reporting on, but it's certainly not unique in the Southern Health region. We see cases climbing also significantly in the last week in the Winnipeg Health region. But this is showing the current trajectory that we've been seeing and what's made us, in some part, move to further announcements today. On the next slide, you can see that in addition to geography, if we look at the age, our case counts are increasing most rapidly in the 0 to 19 year olds, which is consistent with other regions as well, but certainly a concern that we've been seeing, which leads us into some of the restrictions we are doing today. If we look at the modeling, when you model again about 6 weeks out from this, we see the on the next slide the current upward trajectory. Here we go. And again, just like with all modeling, the numbers provide us with a range of possibilities, but without any further restrictions, we see the upward trend in Manitoba. We see that this model here at about the 50% range would give us about 200 cases a day at the beginning of December, and climbing thereafter to mid-December. So again, increasing cases always translates to increasing hospitalization, increasing ICU, and that's where we get that strain on the healthcare system. So that is diagnosed cases in Manitoba and about six weeks out. If we look at the next slide, you can just compare the steepness of that trajectory. If we look at our Southern Health region, we see that climb is significantly steeper than the province overall, which we saw earlier on is driving a lot of our numbers. However, not unique to Southern Health. We see cases climbing in essentially all health regions, and there isn't any health region that is not at risk for having increasing case numbers as we move forward. On the next slide, again, some of our most important things that we pay attention to are the strain on healthcare systems. We see ICU admissions here, and again, as we see numbers translating upward in diagnosed cases, that's going to translate into increasing ICU admissions. And we see here that this model at the mid-range of the predictions of this model would be predicting about 3 ICU admissions per day by early December and climbing thereafter. And what we've seen in previous waves, that's not a sustainable number. Admitting 3 individuals per day with COVID to the ICU on a sustained basis is not a sustainable number. And finally, just looking at ICU admissions and the ICU occupancy, we see at the top number there is non-ICU admissions to hospital, again climbing up. We see the ICU admissions on the lower graph, and again showing us that by early December, calling for 40 plus people in ICU with COVID, and so again, looking at the demands on our healthcare system, this would be something that would be a significant demand on the healthcare system. What's trying to currently keep up with all the non-COVID care and catch up on much non-COVID care. So these are some of the modeling numbers that we follow. We run those numbers essentially every week to follow the trends, and has led us in one way to the orders that we're going to announce today. So in addition to this modeling, like we've always said, we take a number of things into consideration: test positivity, the actual trends in hospital admissions, certainly now vaccine rates. We take in consideration. And so we've been seeing these concerning numbers. The projections are concerning. And so we know if we don't take further steps, we certainly are at risk of overwhelming that healthcare system again. So the additional restrictions that are being implemented today, or are being announced today, will be taking effect at midnight tomorrow. And so relates to the religious gatherings in Southern Health region. So the religious gatherings are limited to 25 persons, unless the facility can physically divide their space into separate areas, in which case you can have several cohorts of 25 individuals. The total number of attendees at a service may not exceed 25% capacity of the facility to a maximum of 250 people. Again, that can only be achieved through the use of cohorts if the overall capacity allows. So those cohorts must be separate. They must not mingle in any way. They must have masks on at all times, and distancing rules apply. So this one, again, applies only in Southern Health Santé Sud region. The previously announced municipalities that are in that capital region, again, are not going to be treated as part of the Southern Health region as for these orders. So Cartier, Headingley, McDonald, Richat, Niverville, St. Francis, Xavier, and Taché will be treated as the capital region as per the most recent orders. So this goes into effect Saturday, November 13th, 12:01 a.m. And so again, services that are restricted to fully immunized individuals, and including those under 12 who are not eligible for vaccine, they can still be held without capacity limits in Southern Health. Services that will not require proof of vaccine will have to abide by these new capacity restrictions starting tomorrow midnight. The next restriction that we are moving to is a province-wide restriction, and it relates to that climbing case counts in that 0 to 19 age group. And so proof of at least one dose of vaccination or a recent negative test will be required for the 12 to 17-year-olds for indoor recreational sports. So this one, we will have a grace period to allow sufficient time for people to make decisions. And so this will start on December 5th, and this will allow individuals who are not fully immunized or not immunized to comply. This will be in effect province-wide. Negative tests need to come from participating pharmacies. This will not be tests done at our publicly run testing sites. Those PCR tests are for symptomatic individuals or those individuals directed by their healthcare provider to be tested. This testing will have to be done privately for the sports. And we'll be working with our partners across the province to ensure a planned transition to this new restriction. So these orders will continue to allow fully vaccinated Manitobans to enjoy as much freedom and as few restrictions as possible, while unvaccinated individuals will continue to be restricted in their activities in order to reduce transmission and really and that risk. Again, these are fellow Manitobans that are falling ill, being admitted to ICU. Unfortunately, some still dying. And the more that we can get vaccinated, the more that the unvaccinated are limited in the interaction amongst others, the more Manitobans we're going to protect from COVID. So I want to thank all those Manitobans who are following the public health orders and the fundamentals, and of course the vast majority of Manitobans who have been vaccinated. So I know it's frustrating to be here again. I think we're all disappointed, we're all frustrated that we're once again looking at further restrictions, once again looking at upwards trajectory where our healthcare system is again strained, which really puts that strain on COVID and non-COVID care. All right, so we need to continue to do what we can to bring down transmission to protect all Manitobans, whether they have COVID or not. The updated orders keep the pandemic response system at restricted orange, with schools still remaining in the yellow, and all the other public health orders remain unchanged. So again, I can't stress strongly enough the need for our public health orders and the fundamentals to be followed. The orders have always been only one piece of our response. It always, our response, the success to our response always relied on Manitobans. We always have relied on Manitobans to do what's best for Manitoba, for themselves, and to protect themselves, the people around them, and our province and our healthcare system. So please follow those fundamentals. Please adhere to these public health orders, and we need to continue to follow things. And if we continue to see strain on our healthcare system, we further steps may be required. So thanks again. I'm going to pass it over to Monica Warren, the Provincial COVID Operations Chief at Shared Health.
Good morning. I'm Monica Warren, and I wanted to reiterate that the number of COVID-related hospitalizations continues to rise, and we are seeing increased admission of COVID patients in our intensive care units. In the past week, 15 COVID patients have been admitted to ICU, including 2 yesterday. As of midnight, there were 86 patients in our ICU, and this number includes 30 patients with COVID, which constitutes a jump of 25% just this past week. Most of these patients are unvaccinated. Overall, there were 145 patients hospitalized due to COVID in Manitoba, and this again is up 27 patients, or nearly 23% from 1 week ago. 12 of these patients are under the age of 40, and 3 are under the age of 20. So as we continue to build up our capacity to respond to what we can now confirm is a surge, there is an unavoidable impact to non-COVID care. Over the past number of weeks, we have been preparing for this increase in hospitalization by taking a very close look at our patient demand for our hospital beds and our available capacity. And as we've shared previously, the two just do not line up, and this has resulted in some very difficult decisions to move some patients whose care needs are able to be met elsewhere and to make room for those that are waiting for care. This is a decision that is very firmly based in clinical assessment to ensure these transfers are safe and that our patients are able to have their ongoing care needs met at the receiving facility. However, we know these are very stressful situations for patients, families, and our care teams. Unfortunately, as COVID activity has continued to rise, these moves continue to be necessary, and we will continue to assess every patient to match them to an appropriate and available bed. We will also continue to offer support to our patients and families in navigating these very challenging moves and encourage them to connect with their care teams and to our patient relations offices for access to spiritual care and other supports. It is our hope that these are time-limited moves, and so we ask for patience and understanding from families as we make decisions that are necessary to support care for all Manitobans. As of Wednesday, 24 of these moves had occurred across the province. In the past several days, it has been determined that we need to create even more capacity, particularly for our sickest patients, as we see an increase in COVID admissions, both to hospital and to ICU. While we anticipate the addition of approximately 40 nurses who are set to complete their critical care orientation on November 22nd, we need to begin increasing our capacity in the coming days as we do expect COVID admissions to only continue to rise. This morning, meetings are occurring with staff, nurses in a number of healthcare facilities, and these meetings are to inform nurses with previous critical care experience or some specialized training that they had prior to Wave 3, that we will need them again, once again, to support our sickest patients in ICU. This will impact a number of Manitobans with procedures scheduled beginning November 19th. Patients whose procedures are affected will receive a call from their doctor or surgeon's office. Operating room slates will continue through to November 18th, and patients who do not receive a call should proceed to their appointment as scheduled. This change will affect 2 slates at the Pan Am, 2 slates at Misericordia, 2 slates at Victoria, and endoscopy procedures completed at the Seven Oaks Hospital. These reductions in surgical activity will allow for an increase in beds, and we anticipate bringing our ICU bed numbers to approximately 110. As a reminder, our normal pre-COVID ICU baseline is 72. We did not want to be here again, and we are both grateful to the staff whose work and personal lives are once again being disrupted. And I want to thank you very much for your understanding, and thank you for your commitment to our patients and all Manitobans. To our patients, we also thank you for your understanding, and we want to express our disappointment that your ability to access care is once again being affected. We hope that these reductions are short-lived and that we will be able to send our nurses back to their home units and reschedule those patients as soon as possible. The other thing I wanted to mention is we are also seeing an increase in a number of outbreaks being declared in healthcare facilities, both among patients, residents, and among our staff. Enhanced cleaning and disinfecting protocols, visitor restrictions, and other measures are in place in these locations to attempt to reduce the spread of the virus. We are seeing increased hospitalizations among fully vaccinated Manitobans, including those affected by outbreaks. These vaccines are safe and they continue to be very effective in preventing the most severe illness related to COVID. But as increased COVID activity occurs throughout the province, there are increased chances of breakthrough infections. So we all need to continue to be cautious and extremely vigilant to make sure that we use every preventable measure available to us. And finally, I want to remind Manitobans with loved ones in our personal care homes that effective Monday, all designated family caregivers will be required to show proof of full vaccination upon every visit. Those who are not fully vaccinated will continue to be able to visit their loved ones, but will do so as general visitors in a visitation shelter or another designated space and will be required to make an appointment. And with that, let's open it up for questions.
I guess I'm going first. Oh, go ahead.
I just wanted to thank Dr. Rusin and thank Monica for her comments and say that we believe these public health orders are the best way to protect those who cannot protect themselves. And this is the best way to protect all of us through this fourth wave. So I'm asking Manitobans again to please do your part and not only get vaccinated, but continue with those fundamentals that we've talked about since the beginning of this pandemic. Stay home when you're sick, wear a mask, continue to socially distance. And thank you again to the more than 84% of eligible Manitobans who've been vaccinated to protect their own health and those around them. And we will now take questions. Thank you.
Forgive me, Minister. Dr. Rusin, forgive me. The press release isn't out yet. So you said there were 3 measures, but I only heard 2. One involves the religious institutions in Southern Health. The second being kids sports, 12 to 17. What was the third?
Well, the third one is connected to the rec there. It's overnight camps will be considered those indoor recreation facilities. So we'll still have the same leeway and still 1 dose requirement.
And you said there will be, how often there will be rapid testing for kids in sports? Is that what you?
That's right. So similar to the healthcare workers, similar to the federal transport regulations there, it'll be proof within 72 hours of a negative test.
So that is for all rec kids sports age 12 to 17. How many times a week?
Well, within 72 hours
Of them appearing.
Of them appearing if they are unvaccinated. Yeah.
Why not put more, even broader restrictions on, the question will be asked, I'm sure by some of my colleagues on the call, but why not put more broader restrictions on Southern Health?
So I mean, these restrictions right now is about as far as we can go with proof of vaccine requirements and not restricting the vaccinated. And so we want to take that as far as we can. The majority of Manitobans have gone out of their way to follow public health advice. They followed public health orders, and they went out and got vaccinated. So these orders we always balance the effects of them, and we wanted to go as far as we could without starting to affect vaccinated Manitobans.
And Ms. Warren, can you just clarify, when you said moving the ICU capacity to being staffed for 110 beds, you meant for COVID and non-COVID patients?
That's correct. Our full total capacity combining both COVID and non-COVID care.
And do I understand?
One more in the room, Bart, and then we'll go to the phone.
In that case, I'll go to you, Minister. What kind of, I know cabinet confidentiality is something that you're not going to infringe upon, but when you are talking informally to your colleagues, other MLAs in your government, the new premier and whatnot, what kind of urgency is there to perhaps even start in pushing even harder so that to make sure that people have a normal Christmas holiday and a normal retail season? And if you'll permit me, if most people had a choice of a lousy November or a lousy Christmas season, they'd rather have a lousy November. So why not go harder now versus harder later?
And that's a really good question. Thank you for posing it. What I do want Manitobans to know, regardless of the region that they live in, is that I take a look at data and stats with Dr. Rusin and public health officials on a daily basis. Sometimes the statistics are coming in hourly, and we do have other measures that we can take. And so I will be looking with Dr. Rusin and public health officials at the numbers and the cases. And we may be back here as early as next week. But it's no longer going to be that we extend these orders for 2 or 3 weeks and people wipe their brow and they say, oh, good, I have 2 or 3 weeks to not comply. It will be changes, could be imminent at any time, depending on what the numbers reveal.
All right, we'll go to the phone.
Thank you. A reminder to our reporters, you will have one preliminary and one follow-up question. Up first this morning from the Winnipeg Free Press, Katie.
Good afternoon, Dr. Rusin. Given what we've just heard about how this surge is affecting Manitoba's healthcare system, can you explain why these new public health orders don't make an effort to restrict people's movements through different regions of the province?
Mm-hmm. Yeah, and so, up to now, we really haven't had, with the exception of a northern travel restrictions, we haven't really restricted travel between regions. So we have, right now, we see certain transmission patterns. We see previous areas in our restrictions that allowed larger numbers of unvaccinated people to gather indoors, and we know that's a risk. So these orders really shore that up. But like I was saying, after these orders, we don't have a lot else as far as public health orders go before we need to start affecting vaccinated Manitobans, and we want to do whatever we could to limit that.
Thank you. Minister Gordon, these orders place more capacity limits on some religious gatherings. I want to ask you about Spring Church. It recently offered bogus religious vaccine exemptions to its members. It has been ticketed for pandemic violations, and it brought a court challenge against your government because of the restrictions. Why are you still a member at Springs Church?
Now, what I do say to Manitobans is that each and every individual has to be informed, whether it's about COVID or any other health measures that may be brought forward by the health system. So it's important that individuals read the public health order, which states very clearly that there is no religious exemptions, and to be sure that they do the right thing, and that is to get vaccinated, to protect themselves, their family members, grandma, grandpa, and to ensure that all Manitobans are protected. And that is my message here in this press conference today and in all other venues that I participate, that the best defense against COVID-19 is to get vaccinated.
From Global News, Brittany.
Hi, good afternoon. Dr. Rusin, I'm just wondering, we are looking specifically at youth sports and religious gatherings. Can you tell us what you're seeing from transmission chains right now that's leading to that, and how much spread we're seeing in those two particular areas? So
there's a couple of things. So certainly with faith-based gatherings, we're seeing clusters in all health regions, in transmission in all health regions. Certainly to a larger degree in the Southern Health region. And then added to that, just how we know this virus is transmitted, right? Indoor prolonged contact. And so these were the two areas where proof of vaccine was not fully implemented and still had relatively loose capacity limits, so we needed to address it in that way. And of course, with the you saw the numbers there with the youth was a rapidly growing sector of transmission, and so we know that schools is always going to be our priority. A lot of our response has always been to do whatever we can to keep the kids in school. Schools are going to be the last thing to close, the first thing to open, and so we look at other opportunities for transmission of this virus and other ways that we can protect against transmission in this age group on top of what was already being done in schools. And so we saw these the recreational activities were the option we went with.
Thank you. And why not do more to protect those children under the age of 12 who cannot be vaxxed, who may be also participating in sports? Require rapid testing for them or any extras there for the children that can't be vaccinated?
Yeah, and so we had the exemption even for those eligible to be vaccinated, right? That 12 to 17 group. So we've previously allowed that exemption. We're always balancing the benefits of whatever we're restricting versus the risks of COVID, and not only on the individual who's at risk. We know that the risk of serious outcomes in youth is less than that of older Manitobans. Certainly not zero, but just having transmission chains, then eventually it's spread to somebody who is at risk. So we wanted to, again, target those who are eligible for vaccine, get as many eligible Manitobans for vaccine vaccinated as soon as possible. And so that's why we focused on this 12 to 17 cohort.
From the Brandon Sun, Karen.
Sorry, I was muted. Just wondering, the Southern Health region, it's pretty obvious that these measures are targeting that area. Why? If you could just maybe clarify and specify why the Southern Health region is being focused on rather than the entire province or neighboring regions.
Yeah, and so as far as the requirements in youth recreation, that is province-wide. So that's not targeted at Southern Health. For the faith-based gatherings, it's based on a couple of things. One is the transmission, and we depicted the high rates of transmission in that region, as well as as a region, a lower vaccine uptake. And so we want to ensure we're using those least restrictive means. That right now, in places, larger centers, say like Winnipeg, we have very high vaccine uptake. We're not seeing as much transmission, although we did see this last week a significant jump. So we wanted to ensure we're targeting our restrictions where we're seeing transmission, where we think we can have the most impact.
Okay, and also just going back to maybe surgery, I just received a note here that back in March you had a $50 million grant to spend on surgical backlogs. In the last 5 months, only about $2.5 million has been spent. With the new premier, who was the health minister then, has there been any plans to address this backlog and also this spending oversight?
Thank you for the question. So very soon, within the next week or so, we will be announcing the surgical backlog and diagnostic backlog task force. The lead for that task force has been named, as well as the operational lead. I confirmed with the team the names of the membership for that work that has already begun. And yes, so a lot of work is underway. As you know, we sent out a request for supply arrangement, and we've seen several proposals come forward. So some of the funds that has been set aside by our government will be used to carry out some contracts under that process. But there is actually $8.1 million committed through the request for supply arrangement for surgery and diagnostics, and a further $5.6 million in service delivery organization spending for priority procedures.
Thank you.
From the Winnipeg Sun, Glenn.
Good morning. Good morning. Dr. Rusin, the faith-based restrictions on, or the increase in the faith-based restrictions on Southern Health. I don't mean to generalize, although I guess I will. This is an area where there seems to be resistance amongst the faith-based groups. How much do you anticipate the sort of buy-in on this, or is this going to end up being an enforcement issue?
Well, like we've mentioned all along, our success in this pandemic is always going to rely on Manitobans. And so we're always going to need to rely on Manitobans to do the right thing, and we're still going to need to rely on that. So the orders are part of our response. They need to be there, and enforcement is part of the order response, and so that needs to be there in some manner. We all know that enforcement can't be everywhere all the time, but it is an important aspect. But ultimately, we need Manitobans to do what they can to limit the transmission of this virus, and the best way to do that is, one, is to be vaccinated. The next is to certainly follow our public health recommendations and orders.
And just to follow up on that, what would you say to people from Southern Health who, looking at these restrictions, feel that they're being singled out for, I don't want to say special treatment, but they're being singled out as opposed to people who from Winnipeg or those municipalities that are being exempted from this? What would you say to those people who now look at these restrictions and say you're singling us out again?
Well, I think this has been an issue with the public health orders all throughout. So there's been people in certain geographic areas that feel they're being targeted. There's been business sectors that think they've been targeted, unfortunately. So what we say is we're just following the epidemiology. We're trying to protect Manitobans from COVID. We're trying to protect Manitoba's healthcare system so that all Manitobans have access to it. And so again, speaking to people in Southern Health, those are Manitobans. And so we're just trying to get through this together. We do have to follow where the epidemiology takes us, and right now we're seeing a lot of transmission in those areas. We know that transmission occurs with prolonged contact in indoor places, and so you'll see that all of our orders are there directed to try to break up those transmission chains. But this is, for all Manitobans. We're trying to have that healthcare system there for all Manitobans, whether they have COVID or not, whether they're in their south, whether in the north, whether in Winnipeg. We've always been in this together, and so we've never tried to target people. We're trying to target where the virus is being transmitted.
From the Canadian Press, Steve. From the Canadian Press, Steve. All right, let's move on to CTV Winnipeg and Mike. CTV Winnipeg Mike. They may be having some technical difficulties. Let's go back to the news conference theater.
While they figure that out, thank you very much. Doctor, what about competitive 12 to 17 sports like AAA hockey?
Yeah, indoor is going to apply to all, indoor recreation. And so we do have that grace period to give people time to consider this. And then, of course, what we want are people to become fully vaccinated. But we do have that option, that testing option as well.
Sorry, so the testing is I'm confused because the release isn't out, so forgive me. It's vaxxed or testing.
That's right. Yes.
Oh, it's not for everybody.
The testing is for if you can have even a single dose of the vaccine, then you can continue to play.
Okay, thank you. Sorry, forgive me, it's because the release wasn't out, I misunderstood that.
And I do want to add to that currently for the age 12 to 19, we have over 81% of those individuals have at least one vaccine, and over 76% have two vaccines doses. So that's a high number of individuals that are already able to play indoor rec sports.
And who will be enforcing the new religious gatherings restrictions, and how will it be enforced?
So that enforcement will, once again, we will be looking to the Ministry and the Department of Justice with the enforcement officers to carry out checks of religious institutions and facilities in Southern Health, Santé Sud, and so they will be unannounced and regularly checked during this public health order being in effect.
And lastly on that, are we back there yet, Draper?
Yeah, we are.
Okay, because one last one there is, what are you doing to ensure the safety of these unannounced inspectors?
Clarify, please, what you mean by safety. Safety in terms of COVID,
in terms of the personal safety of somebody going in. Do they go in pairs? Is there the usual? I mean, some of the inspectors have reported less than friendly treatment at some of these places, especially with some of the more rogue places that you've seen about, not the ordinary religious institutions.
So we will have those discussions with department officials, and it's always our number one priority to keep our safety officials to protect their health and safety. So those discussions will occur in terms of what needs to be done as far as the numbers of individuals who go to those facilities, but it will be strongly enforced under these new public health orders.
All right, I believe Mike's back on the phone. If we can go.
Yes, we'll try Mike from CTV Winnipeg. Go ahead. Yes, please proceed.
Wonderful. Dr. Rusin, I believe this question was asked, but I didn't hear the answer actually being said. And I think parents would want to know, where exactly are transmissions occurring most predominantly among the 0 to 19 cohort?
Yeah, and so we see a number of areas there, and again, when you're talking about acquisition events, it's difficult, right? Because we just look at where people were during their that acquisition period. So there's a number of places. So if we look at household, this is a very high and always has been a high rate of transmission. We see some in schools, but again, just like in other waves, the transmission within schools tends to be lower than what we see in the community. And then we're going to see that transmission where other places where kids gather, and some of that is in recreation.
Thank you for that. And this can go to Minister Gordon, I suppose. For the rapid testing that parents who don't want to have their kids vaccinated to show, isn't that putting an undue financial burden on a lot of parents who have to pay for these tests?
So at the end of the day, what my goal is, and the goal of Dr. Rusin and public health officials, is to protect all Manitobans. And how we protect Manitobans is by encouraging each and every individual, regardless of whether they play sports or they're involved in any other activity, to get vaccinated to protect those around them. And so the 2-dose vaccines are free, and they're 15 minutes each. And so we're asking individuals to take advantage of that, the access that's available at clinics, at our super sites and physician offices, and to get vaccinated. And so at the end of the day, our focus is to protect Manitobans, to break the chain of COVID transmission by ensuring that you get vaccinated, and the time is now. For parents that feel they want their child to continue to play sports, and I love hockey, I love football, I love all the sporting activities. My son played as well, and I know that there's a lot of movement around the city. We don't just play in Southdale, we play in Stonewall and across many different RHAs, and we need to break that transmission of COVID, that transmission chain. And so if parents feel they do not want their child to be vaccinated, then they can access tests at their local pharmacies, and until they feel they're ready to allow for their child to get the vaccine.
All right, we're going to try for Steve from CP one more time. Steve from CP.
Can you hear me?
Yes, go ahead.
Okay, thank you. Dr. Rusin, the in-house transmission, if I'm reading the lines between the lines and the data available correct.
Oh, I think we lost you, Steve.
Thank you. We will not be able to bring Steve back.
Wait, we'll get him to text it to me. How's that?
Do you have any more questions, Bart?
In terms of the modeling, because the modeling was showing the ranges, and I used my glasses to try to see. I assume they'll make the slides public at some point, or the cameras caught them better. But what was, in numbers, the low-high range of tests by the latest date you have for COVID cases? Was that per day on there, or was that what's the low-high range for the latest date you have in December, the low-high range for hospitalizations, and the low-high range for ICU admissions?
Yeah, and so it's just presented in a graph and not a table, so I just have to extrapolate a bit. So if we're looking at the, say, December 1st, early December, the 50% range, is at about 200 cases per day. The low range is down to about 100, and then the upper range is closer to 300.
And on that note, why would it? We're already, as of Wednesday, at 158 cases per day. I don't know yesterday's count. I'm told today will be 193. It looks like we're going to get to 200 before the end, well before mid-December, but we could be at the current pace. We're hitting 300 at the end of at November. Does this not look a little? What would you say to the idea that these are conservative estimates here?
Yeah, and so the type of modeling that we're using now, you saw that our previous agent-based modeling really mapped out 4 different scenarios, and then we mapped out our actual numbers to try to estimate which scenario we're on. This new modeling that we're using is actually mapping out the scenario we're on, and so for each week that we run it, we will be able to get more and more accurate over time. So there can be a bit of an underestimate here at first, but that will improve over time as we run more and more numbers.
I also have Steve Lambert's questions here via text. Any thought to further constraining private care homes?
In which manner? Like we've just now requiring vaccine for their
designated
care providers. So. So I'm not sure in the specifics, but certainly it's a concern. We have the third dose available there and doing whatever we can to promote that, and then we have a number of the measures in place already.
And Steve, second question for you, Ms. Warren. Are we at risk of sending patients out of province again?
At this point, I think we are doing everything we can to create capacity within Manitoba. And so really looking forward to these numbers coming down so we can continue to manage Manitobans in Manitoba.
I asked the wrong question for Steve. He did not mean private care homes. He meant private home gatherings. Any thought to further constraining what people can do at home?
So we, certainly we're giving thought to that. We know that transmission occurs within, within homes. That's mostly about that mostly represents people who actually live together in the home. Somebody picks it up in community, wherever that is, bring it home. But we know transmission occurs in prolonged contact, indoor public places. We do have pretty significant restrictions on private gatherings in homes for the unvaccinated, and so of course we'll continue to look at that if required.
Okay, thank you very much. Thanks for indulging the
Tech issues.
yeah.
The new restrictions today weren't as extensive as some we've seen in previous waves. But with over 84% of Manitobans now vaccinated, the province is taking a more targeted approach with restrictions. Once again, capacity limits for faith-based gatherings in Southern Health are now restricted to 25 people, unless the facility can be physically divided into cohorts, in which case the total number of occupants cannot exceed 25% of capacity. In facilities where all attendees provide proof of double vaccination, those new restrictions do not apply. This will go into effect in Southern Health tomorrow, November 13th at 12:01 a.m. Province-wide, proof of at least one dose of the vaccine or a negative COVID-19 test within 72 hours of the event will be required to participate in indoor recreational sports for youth aged 12 to 17. There will be a grace period on this restriction, and it will go into effect on December 5th. All other existing public health orders continue to apply.